Virtual ports, internal retractor, EndoGrab. Virtual ports EndoGrab is an internally anchored, hands-free, organ-retracting device for use in minimally invasive abdominal surgery. Loading the EndoGrab on the introducer. Make sure the hook of the introducer is in its open position. Hold the retractor in the other hand with the J-hook facing upward. Engage the hook of the introducer with the J-hook of the EndoGrab. Pull back gently on the introducer trigger until you hear a click. The EndoGrab is now in the anchoring mode. Continue to pull back on the introducer trigger until you hear another click, and release it. Inserting the EndoGrab into the abdomen. Insert the loaded EndoGrab introducer into the abdomen through a trocar. Pull the trigger to open the EndoGrab flap. Retracting an organ with EndoGrab. Grab the organ between the teeth of the flap and release the trigger to close the flap on the organ. Press once on the stopper to release the EndoGrab. The EndoGrab introducer is now in the anchoring mode. Direct the J-hook of the retractor to the desired location on the internal abdominal wall and penetrate it with the hook to retract the organ. Removing the introducer from the abdomen. Press once on the stopper to release the introducer hook. Slide the introducer hook down the shaft of the J-hook. Push the introducer slightly toward the peritoneum to disengage it from the J-hook, and slide them apart with a right lateral movement of the introducer. The introducer may now be removed through a trocar, leaving the EndoGrab retractor in position. Changing EndoGrab position or removing EndoGrab. Insert the empty introducer through the trocar into the abdominal cavity. Approaching from the side, engage the hook of the introducer with the shaft of the J-hook of the retractor, and with an upward lifting motion of the introducer, remove the EndoGrab hook from the tissue of the abdominal wall. Pull back gently on the introducer trigger until you hear a click. The EndoGrab is now in the anchoring mode. You now have the following options. You can reposition the EndoGrab on the abdominal wall, or you can remove the EndoGrab from the abdomen. Move the organ back to its place and pull the trigger until it clicks and opens the flap. Release the organ from the flap and release the trigger to close it and load the EndoGrab into the introducer. Remove through the trocar. Troubleshooting. The J-hook of the EndoGrab must be facing upward when engaged in the introducer hook. If it is facing downward, it will not be in the correct position to be anchored on the peritoneum. In case of an undesired release of the EndoGrab, approach from the side and engage the hook of the introducer with the J-hook of the retractor. Pull back until the EndoGrab is aligned with the introducer. Pull back gently on the introducer trigger until you hear a click. The EndoGrab introducer is now in the anchoring mode. Do not engage the J-hook along its shaft. Engage only at the curved end of the J-hook. The J-hook should be facing forward when the EndoGrab introducer is in the anchoring mode. If the J-hook isn't facing forward, pull back on the introducer to realign the J-hook.